It is Thursday, May 20th. Welcome to the Kahnawà COVID-19 Task Force. This is our 211th update, and it is a very important one because tomorrow the situation in Kahnawà will change. And to tell us about that and more is the Executive Director of the Cattery Memorial Hospital Centre, Lisa Westaway.
Good afternoon. Yes, we're really excited to announce that we are changing the alert level from red to orange, and we released a communique last week detailing the rationale for that, and spoke about it last week as well. But mostly it's regarding the current situation both in Kahnawà and outside of Kahnawà, and as we see, the numbers are drastically decreasing in number of new cases per day. We have 2 active cases in the community right now, and a big decrease in the number of people who are presently in isolation. In the Montérégie and in Montreal also decreases with just over 500 new cases per day, and decreases in hospitalizations, decreases in a number of deaths. We do still have outbreaks that are happening in the communities around us, but that also has decreased. What has increased is the number of cases related to variants, and so we continue to watch that closely. However, what we're seeing around us in Quebec especially is that vaccination and vaccination rates, which are quite high compared to the rest of the province, the rest of the country rather, are really making a difference, and they're making a difference here, and that's why we're able to move forward in even our reopening plan, which will be presented to you next week. So in the meantime, we do have other good news to present to you. The first is vaccinations, and a release went out just a few minutes ago, letting the community know that we have secured vaccines for 12 to 15-year-olds. So again, this is Pfizer vaccine, and we've already set up Click Santé, so you can go as of right now onto the Kahnawà 911 website, click on Click Santé to make an appointment for vaccination for your 12 to 15-year-old. And that is starting next week, Thursday, Friday, and Saturday, the 3rd, 4th, and 5th, and the hours are in the communique, so you can see that on the Kahnawà 911 website. We ask that you make an appointment. This is important because as we're nearing the end of our vaccination campaign, we don't want to waste doses, and this allows us to be better prepared and organized in order to ensure that we use all the doses that we have. So just a mention that if you're under 14, you do need parental consent to be vaccinated. So either a parent, one of 2 parents has to accompany the child, or you can complete the consent form that is online on the Kahnawà 911 site, but you have to give in a cell number on that form so that we can contact you just before the vaccination. So why is that? Why do you have to fill out a form, and why do we need to speak with you? And that's called what informed consent is. So it's not just completing the form, but we have to actually have a nurse speak with a parent to explain what the possible side effects are, so that the consent can be given following that explanation, and that's called informed consent, and we have to have that before we can vaccinate anyone under 14 years of age. So that's the first update. We'll be releasing information next week about vaccines, but I'll give some preliminary information today. So again, the 3rd, 4th, and 5th is 12 to 15-year-olds. We're also happy to announce that we'll be vaccinating second doses for Moderna the weeks of the 7th, 14th, and 21st of June. So appointments are not yet open for that, and we know some of you might already have your appointments for second doses, so we'll be changing those appointments to be able to vaccinate you a little bit earlier, and we'll be giving you all of that information next week on how that's going to happen. Also, the week of the 28th, we'll be doing second doses for Pfizer for our 16 and 17-year-olds. There are still a few that have to be done, although today we were vaccinating 16 and 17-year-olds as well as elders who had received their first dose of Pfizer early in our vaccination campaign at the beginning of March. So things are really moving along quite nicely with respect to vaccination, and by the end of June, we expect that our whole community will have had the opportunity to have their second dose. So this is really, really good news, and has contributed to some of the decisions that we'll be presenting to you next week with respect to our reopening plan here in Kahnawà. And we are ahead of the rest of the province, so it means that we will have some luxuries before others in terms of reopening if things stay stable as they are right now. One last thing about vaccinations, we do have about just over 20 people who were vaccinated at home. They are homebound and they were unable to make it to the vaccination site. So some of those people were vaccinated with AstraZeneca, and we'll be making arrangements individually with all of you. I think many of you have already been called, and dates for your second dose will be announced to you individually in the coming week. Anybody who still wants a first dose, and we are still getting requests, there are two ways that we can make that happen. Number one is that you call the KMHC pharmacy. They still have Moderna available. They will make arrangements with you to be vaccinated at their LaSalle pharmacy on Airlie. So you can contact them at any time and they will make those arrangements with you. You can also contact the public health, public safety line, as you've been doing up till now, and leave your name and phone number. And during any one of the weeks to come, we will be sure to make arrangements to vaccinate you with your first dose. So there are still possibilities for anybody who's interested in being vaccinated. And as you know, Quebec is also has also opened up their vaccination for 18 plus. So anybody interested in being vaccinated in any of our surrounding communities can also make an appointment through the Quebec.ca website, I believe, for your vaccination. We expect Quebec to be releasing information about their plans for 12 to 15-year-olds today. However, as I mentioned, we'll be ahead of the game in doing that next week, so we're happy about that. Last thing that I wanted to mention is about QR codes. So many of you are receiving either a text message or an email, especially if you've been vaccinated after May 13th. You're receiving that information by text message or email, kind of a link that will bring you to a QR code, which is a proof of vaccination. So after May 13th, you're receiving that automatically if you made your appointment through Click Santé, and that matches the information in the vaccine registry. So at KMHC, for all vaccines, whether it be childhood vaccines or any type of vaccine in Quebec, is registered in a specific site called SIPME. So that's not very important, but what's important is that the information in that vaccination registry needs to match the information that has been placed in Click Santé, and if it does, then you receive an email or a text message with proof of vaccination. Remember, when you come to the bingo hall or wherever you've been vaccinated, you also receive a paper copy, which is proof of vaccination. That paper copy is important for you to keep, take a picture of. That is your proof of vaccination. The QR code is an electronic proof of vaccination, but not everybody has received it. So if you do receive it, it's not spam. It's important that you click on the link and you save the QR code that's given to you if it's important to you to have that proof. For those who have not received it, or anybody who was vaccinated before May 13th, if your information is in Click Santé, then you will receive your QR code in the coming weeks, not to worry. If your information was not in Click Santé, so you didn't take an appointment but you called KMHC and you booked your appointment by phone, then there will be a way to get your electronic QR code in the coming weeks through the Quebec.ca website. That is not ready yet, and when that link is ready, we'll be giving it to you so that you can just easily go to the website, click on it, put in some nominative information, and a QR code will be sent to you. So that will be coming at a later date. So we just wanted to dispel any confusion about those codes that are coming to you, and a communique will be released later today so that you have written information if you need to go back to it and better understand what's happening with those codes. Quebec has not yet defined how they will use those QR codes. We just know that they're being sent. We know that they're proof of vaccination, but we don't know what they'll be used for in the future. So that's for us to wait and see and find out. I think that's it for my updates today, but on Tuesday we'll be providing you with a bit more details about vaccination, as I mentioned, for second doses Moderna. Thanks.
Thank you very much, Lisa. And as she said, the QR codes, actually it's a Quebec initiative, but we're putting the information out for your information, and of course lots of people in Kahnawake have been asking about it anyway. So up next with a very important update is the Commissioner of Public Safety, Lloyd Phillips.
Thank you very much, Joe, and thank you for all the information, Lisa, and certainly a lot of hard work being done by KMHC and your staff to ensure that the vaccinations are rolling out much quicker in Kahnawake than anywhere else. And glad to see by the end of June that anybody who wants a vaccine will have a vaccine, and anybody who wants to get the second dose will have the opportunity by the end of June. Again, that's great news, because that is a major key in ending this pandemic and getting us back to a state of normalcy. And yes, we are glad to announce, as was mentioned last week, and as Lisa just mentioned a few minutes ago, as of tomorrow, we are downgrading the alert level to orange. After many months of being in the red, we feel confident and able to lower that alert level to orange. I want to underscore that even though we are in the process of lowering that level, that again, people still need to remain vigilant, still remain careful. Even as things roll out in the community, new measures being lifted, businesses gradually reopening. Again, it's being done in a phased-in approach in order for us to ensure things are monitored closely. And like I said before, we don't want to kick open the door, so to speak, on day one and then deal with the consequences. We want to be able to do a measured opening, but also, we don't want to take a timeline that's unrealistic, but we want to take a timeline that ensures safety, but also ensures, in the case of businesses, that they could operate, efficiently as possible. And phase one, as we announced last week, is a step. We did receive feedback over the past week regarding this first phase. Primarily positive. People see that it is a progression, and people see that it is a step in the right direction. And keep in mind, this is the first step. And we will be working on that in the next weeks. As a matter of fact, we do have some draft step 2, 3, and 4 that has been done. It will be further discussed tomorrow, as well as with the task force next week, to finalize those steps as they roll out in the weeks to come. The goal is to have something released publicly, next Thursday, which will provide the roadmap, over the next month or 6 weeks or so on, again, returning back to whatever our new normal is. We do have a graphic in which we're going to put up that kind of outlines the areas in which, are currently phase 1. As of tomorrow, there are the abilities for businesses to reopen if they so choose. My understanding is some of them did not want to open with these current restrictions, which again is their prerogative. But again, this is the first step, and more steps will be coming. And here you see, like for example, cigar lounges. The terraces are going to be permitted to open, and sell their product. At this point in time, alcohol sales are not permitted, but the retail side of it, which they've been open for some time now, can maintain their operations. And restaurants as well can open up their terraces, as well as indoors to a maximum of 25% capacity, and they do require the inspectors to go there to verify the layout and making sure that it does meet the current criteria. And keep in mind, at this phase, the first step, we are looking at Kahnawake only. And as well as, if people are employees of the community, they are also welcome to enjoy the establishments. Could be felt as important because as a first step, we want to ensure that we do it in a measured approach, and that on day one, to be quite honest, we don't want to have a large influx of non-locals coming to the community. So we want to ensure that that it's done in a structured way, because as the restaurants, both terraces and indoors, are closed outside the territory, we want to make sure that we're able to monitor this in a way that it makes sense and it respects everybody's wishes as best as possible, because I know there are still some people who are concerned with the reopenings. Now, some of the other areas, that have been opened already, and they will maintain their current level of vigilance and current level of measures outlined there. No manufacturing, for example, the golf courses, aesthetic services, they all been operational. They all do have some restrictions in place, but as this phase one, for those ones, what currently exists will remain. Same thing for gyms and fitness centers, for example. They have been operating with 8 people maximum. During phase one, we're looking at that remaining the status quo. I'd like to point out on that one, again, outside the territory, gyms and fitness centers are currently closed. So in that case, we are still ahead of the rest of the surrounding communities, largely based upon the compliance of our community, and largely based on the number of vaccinations we have. Taxis as well has been operational. There, it's pretty much ensuring that people maintain as much distance as possible. I mean, it's difficult in the car, but certainly if everybody's wearing a mask, open a window if at all possible. You minimize those risks. As well as we want to look at other areas other than businesses, organizations. For the most part, many of the organizations have been working with a minimal staff, skeleton crew, essential services only, for a past while. Again, to ensure that minimize contact with individuals. In the workplace, because again, workplaces up to now, especially recently outside the territory, have proven to be one of the larger areas of transmission of the virus. So it was the proper decision to keep people working from home as much as possible, and maintaining the vigilance there. Not to say these people have not been working; they have been working, but they have modified their work environment, and a lot of people have been working from home. In terms of the school system, we don't anticipate any changes, for the remainder of the school year. The school year, as we know, is coming to a rapid end in the next few weeks. Again, decisions made early on by KEC and the task force to minimize the school attendance, and the way it was set up in a hybrid model has proven to be successful once again, because we had very minimal cases related to schools, unlike we've seen throughout the province, where schools have proven to be a trouble spot throughout especially the third wave. Step-by-Step Early Learning Center as well, same thing. They have been doing an excellent job throughout, and they will maintain status quo for the time being. Some of these things are subject to change as things evolve, but that is the current plan. And as well, we're looking at the indoor and outdoor non-contact organized sports recreational stuff. That has been approved officially as of tomorrow, but we did have some pre-approvals done for softball leagues, for example, to get started. Again, recognizing the fact we are ahead of the game in terms of vaccination and compliance in Kahnawake, and this is one area we felt comfortable moving forward with, well ahead of what's happening around the community. No outdoor, no non-contact recreational sports. There's lots of detail in that one. The people who are involved in that sport or organizers are well aware of the current rules. And as we speak right now, that these are the rules. And again, things could be subject, and more than likely will be subject to modification as the weeks roll out. Okay, outdoor no gatherings is another area that we have done in the community well ahead of anywhere else. We're currently, as we speak today, 8 people allowed outdoors, no on your back deck or your backyard, but as of tomorrow that will be increased till 12 people. And as well, you know, the indoor gatherings or visitation, we felt at this point we still need to keep that at 1 household visitation, you know, at this point in time. And things again will continue to evolve as the weeks roll out, but this is the initial plan, and we feel confident taking this step, you know, because it is time. Based upon all the information that Lisa had given, as well as if you factor in the mental health of our community, you know, the need to have meaningful, you know, contact with loved ones, you know, recreational activities to do, you know, and starting to, you know, maybe go back to a restaurant or other activity which you enjoy is all part of that transition back to a pre-pandemic mode. Keeping in mind, you know, even as we look towards, you know, end of the summer and such, you know, things may not change 100% back to the way they were prior to the pandemic. And this is not only for Kahnawake, this is probably around the world. But you know, we do want to get back to whatever that new normal is going to look like, you know, as soon as we possibly can. So, you know, we just wanted to point out a few areas that I want to emphasize that we did have, you know, as I mentioned, a plan that is being developed and put into place. Now that will lay out the path moving forward. Again, it's important that we do this in a very, you know, staged approach. Now there will be also information, you know, forthcoming next week regarding the rollout of additional you know, visitation and reopenings for inpatient at the Kahnawà Memorial Hospital Center, as well as Turtlebell Alders Lodge and ILC, the ones that we've been, you know, protecting the most throughout. So there'll be announcements coming on by that next week. And again, I think all in the positive direction, and again, more information to follow on that. Again, this is a very exciting time. Things are changing. Things are moving forward. You know, that light is getting brighter at the end of that tunnel. But it's also a stressful time for many people, and it actually, you know, a stressful time, you know, for myself, you know, and the task force, because you know, there is still many unknowns, and we still need people to remain vigilant, you know, follow the measures, and respect the fact that we're taking those steps in a measured approach, and we certainly don't want to see any major outbreaks in the community, and with everybody's cooperation, you know, we will continue down the path towards normalcy. Now, keep in mind, as we mentioned last week, we're not expecting to have no more cases in the community. Likely we will have more cases. Hopefully it will remain at a minimum. But again, with the proper contact tracing, people, you know, wear masks and people getting vaccinated, you know, we could minimize that as much as possible and continue down that path. So again, a lot of information for you today. We are going to be having another Facebook Live next Tuesday to give you more information on vaccinations, more updates on business openings, as well as Thursday as well, where the goal is to present the phase 2, 3, and 4 of the reopening plans for Kahnawake. So with that, thank you very much, Nyamagoa, and thank you for your patience.
Thanks so much, Lloyd. And as he mentioned, there's lots to digest this time around. Just a couple of housekeeping notes. For those who are still looking to receive a first dose, Lisa mentioned that you can contact Public Safety. For those of you who want to do that, the number here is 632-0635. Of course, that's area code 450. Also, tomorrow happens to be the 21st, and that means that for the 14th consecutive month, we will be in a state of emergency, but that's something that is being considered and hopefully we will not be in that state for very much longer if things continue to go the way they're going. So that'll be it for us. Take care, everyone. It was good of you to join us. And tomorrow again be very interesting. And when we are back next week, that little sign up there will be orange, which is a very nice thing for all of us. So take care. We'll see you next time. See you next Tuesday. Onegiwahi.